Hello, everyone, and thanks for coming to this session. We're going to give folks a minute or two to join, and then we'll get started. Thanks for making time today.
I'm waiting until it becomes 1:01. It's 1:01 by my watch. So how about we get started? Thanks everybody and welcome. So you just heard from Cynthia Boyd, who is a professor at Hopkins and one of the co-directors of our pilot core. My name is Alden Gross, and I'm also at Hopkins and another co-director. Also in this session, you're going to hear from Dan Polsky and Frank Shu about some opportunities as part of this pilot award session. Next slide, please. So we're inviting pilot applications for our head center, and we particularly are interested in pilot grants related to two HEADS themes that we have. HEADS stands for Hopkins Economics of Alzheimer's Disease. I should have mentioned that earlier. Our first theme is proposals that identify a range of care needs of persons with ADRD and the economic consequences of ADRD for patients and families. And our second HEADS theme is examining how the organization, financing, and delivery of services affects accessibility, affordability, quality, and equity of ADRD care. Racial disparities in caregiving are also cross-cutting areas of interest that we are interested in. Next slide, please. So these pilot programs are distributed as part of our goal. Overarching mission is to provide funding into the regulatory monitoring of novel pilot studies that can advance research within our themes that I mentioned on the previous slide, develop the careers of researchers addressing these themes, and attract investigators into the field. Next slide. In terms of some details, we during $5,000 or so per award, with the flexibility of additional funding available based on innovation and breadth of pilot scope in the coming cycle. We're particularly interested in supporting promising postdoctoral fellows and junior faculty, although applications can come from folks of any rank. We do encourage applicants from underrepresented racial and ethnic groups, as well as individuals with disabilities. Next slide, please, to our key dates. In terms of key dates, we have an optional letter of intent that we'd like you to give us that are due January 2nd, just so that we know, what's coming in. Complete proposals are due a month later on Thursday, February 1st, and awards will be announced in early April of 2024. So Cynthia, do you want to take it from here?
Yeah, thanks, Alden. And we are very, very glad to share these details with all of you. So just some pilot proposal guidelines and a little bit more information about process. So studies should use and advance methods in either or both economics and health services research. And research should inform efforts to improve the care of people with ADRD and or mitigate the economic burden of ADRD. So for project duration, we would like to see proposals that can feasibly be completed in 1 year. And as Alden mentioned earlier, we have up to 25,000 per pilot available this year. That accounts for both directs and indirects, with flexibility of additional funding available based on the innovation and the breadth of pilot scope for the coming cycle. So the letter of intent that we mentioned earlier, these are optional, but we would really love to see them, as it allows us to make sure we have appropriate reviewer expertise and enough reviewers that don't have conflicts of interest and so forth. It really helps us plan for the best kind of study section for your proposal. It's not binding, and your study design and key details can absolutely change after submission. And so that due date is on January 2nd, 2024. But as noted above, it is optional. So the proposals should include a cover page, which is 1 page, and then have sections of study aims, significance, innovation, approach. And we're really interested in what future aims are. So what is this pilot award going to help you lead to? That could be a career development award. It could be a larger grant award to the NIH, ARC, or other funder. But we'd really love to know how this pilot will help you move your research forward and advance key things and obtain future funding. There are some required supplemental documents which are available in the RFA, and these include as well budget forms. And all of these pieces will be due on February 1st, 2024. So in terms of who's eligible, institutions can be colleges, universities, medical or nursing schools, or other fiscally responsible organizations. And we have the specific criteria spelled out in the RFA. If you have questions, please don't hesitate to let us know and to ask them. But it is a pretty broad tent of places that are able to apply for NIH funding, that are allowed to apply for this pilot proposals. So for the eligibility in more detail, the principal investigator must hold a doctorate degree. This could be an MD, a PhD, a PharmD, or equivalent like an SCD. And they must hold a faculty, research scientist, postdoctoral fellow, or equivalent position by the start date of the award. Applicants from underrepresented groups, as well as individuals with disabilities, are strongly encouraged to apply for funding, and we really encourage interdisciplinary research teams. So really think about who the folks are who should be contributing to both this pilot and the future work that you want it to lead to. So mentors, these are only required for a PI who is a postdoctoral fellow currently. It's optional for everyone else, but if you think that they're going to play a substantive role or help you, you're welcome to include the NIH biosketch of anyone who's on your team. If you do have a mentor, please include their NIH style biosketches, or give us their name and email so that we can connect with them. So this year we've introduced something new, which we're really excited about. We're going to have office hours if you are interested in meeting one-on-one with our pilot core faculty. So the link here will take you to a page where you can sign up for our office hours with your name and email. And there are a number of our faculty that are part of this. So we would really look forward to hearing from you. And I apologize for the technical details of my figuring out how to go back to the PowerPoint. I think I'm going to need to stop sharing and share again. Apologies, everyone.
Cynthia, I think we only see your PowerPoint. So it's okay.
Okay. All right. Well, let me share again then. All right. I'm sorry, everyone, for my You'd think by this far into the pandemic, I would have this down pat.
Rashmita asks if these slides will be shared. Yes, they will be.
Thank you. Okay, so there's a link that will follow where you can basically sign up for a one-on-one meeting with our pilot core faculty, and that will be shared with all of you who are registered, and it will also be available in our materials on the website if any of you are watching this recording afterwards. We will send you a Zoom link 24 hours prior to the office hours appointment, and office hours are limited to one 15-minute appointment per applicant. So if you have any difficulties, don't hesitate to reach out to us. I now am going to head to a slide about the data resources that are available. And I believe that Frank or Dan is going to briefly chime in about this.
Yeah, I can do that. Thanks, Cynthia. So
thanks, Frank.
Yeah, so I would like just to give an overview of the resources that you will be able to leverage as a pilot awardee. So we would like to kind of use the time to mostly take questions from you, but just to highlight that we recently did a presentation on all the data resources that are available through our HEADS Research Data Enclave, and see that you can find the link in the slides here on YouTube, and we have generally three large categories of resources. The first one is CMS Medicare and Medicaid claims data. We have both traditional Medicare and Medicare Advantage claims data, and we have Part D data as well. So we also include here a link to the website that have a list of the data files that will be available to you through the Research Data Enclave. And we can also facilitate access to CMS claims linked NHAS and HRS data. And and as HEADS Center, we have also built a repository of contextual data on long-term services and supports, which you'll also be able to leverage. And so these are the resources that you want to keep in mind as you think through what's feasible for your pilot project. Thanks. And Cynthia, are you going to kind of close out?
Yes.
I think
thanks so much.
Last.
Sorry?
Yeah, I think this is last before the thank you slide.
Yeah. Thank you so much, Frank. Yes, Frank and Dan did a beautiful entire webinar about the data resources available in the Enclave. And so we would, and this will be in the slides there, it will be posted shortly on the YouTube channel, and we'll share that link with you. And if you have more questions about using our data resources there, we encourage you to check out that recording. And if you have any difficulties, of course, feel free to reach out to us. Dan also put the link, one of the links in the chat, if you're able to see that today. So I think we will then next turn to questions. And I'm going to just briefly put this up so that you can see the email address, but we'll open it up to your questions in the chat.
Preeti asked if there's a preference for applicants who use the data resources from the Hopkins Data Enclave. We do get this question every year. I responded, not necessarily, except insofar as the use of the data enclave may have implications for feasibility of completing the work within the allotted time, and it's really cool data. But that said, you want to choose a data resource that addresses the question that you have that's most interesting. I don't know, would you agree with that, Cynthia?
Yes, I think that's right. We judge it based on the science and the methods you propose. And so we've funded, and you can see past awardees in our prior webinars, we've funded things that both use the Enclave and research that is based on data elsewhere. So I think the big goal would be to propose the best science, but I think Alden, you're exactly right that as using the enclave may make things more feasible for some applicants, and that is feasibility is something that we look at in terms of being able to get the work accomplished in a year.
How much money should I budget for the use of the enclave data to be used in the pilot? And how should I get that information? Frank, do you want to take that?
Yeah, sure. And then please feel free to chime in. I think the use of the server, our data server is complimentary, so it's free of cost for pilot awardees. But depending on your topic, there's might be kind of reuse fee that need to be paid to CMS. So yeah, I would encourage you come to check in with us. If you would like to use CMS data to see if your topic falls under one of our current DUAs. If it doesn't, then you might want to kind of budget in the $2,000 reuse fee to CMS in your proposal.
And I'll just add that the goal of we have the CMS data that require there to be a data use agreement in place to be able to use these restricted data files. It takes like 6 to 9 months to put a new data use agreement into place, maybe a little shorter or longer, I'm not so sure. But we have a data use agreement that's directly tied to the heads themes. And so in terms of what's most important for putting a pilot together is that it connects to the heads theme. So presumably your proposal would fit within our existing data use agreement that's connected to heads. So that's number one, is that you could get started right away on a pilot using restricted data because your project would presumably align with the themes. Of course, it'd have to be evaluated on a case-by-case basis as, maintaining, being strict with our interpretation of our data use agreement is important for maintaining our relationships with CMS and our connection to our commitment to the security of the data. So that's number one, is data use agreement. Number two is what are the data? So you can see in the link that I attached there, the list of the data that we have. And so if you write a proposal that uses those data within the data use agreement, the only other charge is really to, for all the services that apply to having access to the server, and those services for Heads Pilot, as Frank said, are covered through the core of Heads. So you wouldn't have to pay that fee. The third potential charge is if you had your own special data set that wasn't on there that you wanted to link to claims. Like, for example, maybe there's some contextual, zip code level data that are important for what you're studying and aren't available anywhere else, and you have to purchase that file. You should certainly budget for other things you might purchase that you would upload into that environment and merge onto the data. But probably the most important thing is to make sure you have enough budget to manipulate the data. You might need support with a programmer or to make sure that you have the the sufficient skills, the sufficient team to work with these data. Can be quite complex. We can support some learning of faculty, of a programmer or something, but that is not covered in Heads or in the RDEC environment. Is just the analytical time to use the data. So that's what you want to make sure in your applications, that you can convince the reviewers that you have the capacity to make use of the data in a way that'll achieve your aims.
Thanks, Dan. That's really helpful. And just to note that when you get the slides, there is a link to sign up for the office hours, and both Dan and Frank, as well as Alden and myself and our other heads faculty, have time available. So if you have questions about using the enclave, you can probably direct who you choose to sign up with to be able to get feedback and input.
And whoever's doing the share, maybe they could pull it down. We can see more faces, and people
Sure.
should feel free to ask, turn their camera off, or, turn their camera on, or leave it off if they want, but just ask the question. There's a lot of things coming up in the chat, but feel free to chime in.
Jenny Recre, I see you asked, is it okay to have two PIs working collaboratively on a proposal? I would say absolutely. We're interested in judging really good science and good ideas, and if there happen to be two of you, that's collaborative, and that speaks to also to feasibility that the thing is going to happen.
There was also a question about adjunct faculty, and I think that we would definitely encourage you to perhaps sign up with one of us to chat, to think both about the science and whether or not there's a way to make yourself eligible. I think adjunct is technically outside the guidance that we have, but we really are trying to foster the community, and would certainly be happy to talk more about that in office hours for anyone for whom that is a question. It's probably a little hard for us on the Zoom call to figure out if a specific person is eligible.
Yeah.
Any other questions?
If you're willing to share, we're happy to give you thoughts about particular research topics. With the caveat that Alden Gross is not an economist, and so I would be making things up. You should totally listen to Dan and to Cynthia and to Jennifer Wolf for their views.
We're good at making things up too.
I'll put the link to sign up for office hours in the chat as well. And as we said earlier, we will share the slides afterwards. So that's the link to sign up for office hours with us. Well, I think we can, oh, sorry, go ahead.
I'm looking at all the names. I expect we'll see applications from every single one of you. Like the best way to get a pilot is to make sure you submit pilot application. And if it's your first time doing it, it's the best way to learn. So I hope this, committing to this webinar is also a kind of a commitment to doing the hard work of getting a pilot application together, and we hope we see one from everybody. And if you run into some struggles and need to reach out, we'd be happy to connect, and that's really what we've created these office hours for that purpose.
Great. Well, we're so glad that you all came and checked it out. Let us know what questions you have. You hopefully by now know where to find us. And like Dan said, we really do encourage you to apply. We look forward to seeing your application and appreciate all of your interest in the Head Center. Thanks, everyone.